今日お集まりいただいたのはですね、超難関で知られている。
Hello everyone. Today I invite two medical students for discussion. And I'm thinking of having them study about the important topic that is currently causing a stir in the Japanese society. Well, let's see what will happen. Do people who watch this video think that medical students are really excellent, or do they think that you are not very good? Okay, let's get started. Let me show you the first slide. As you probably already know, this is multi-step carcinogenesis. It is said that cancer develops in middle age, grows gradually, becomes malignant, and kills the patient. There are many types of cancer. Pancreatic cancer grows so fast that treatment is difficult to help patients. Lung cancer and stomach cancer don't grow as fast as pancreatic cancer. So if you can find it early, you won't die from it. Thyroid cancer grows very slowly and does not kill patients easily. So it's okay to take time to treat it. This happened before you were born. In 1986, the former Soviet Union's Chernobyl nuclear power plant in Ukraine suffered an accident. As a result, radioactive materials leaked outside. Subsequently, thyroid cancer in young children increased rapidly in Russia, Belarus, and Ukraine. The reason is that radioactive iodine leaked from the nuclear power plant. Radioactive iodine can cause thyroid cancer. I bet you all know this. In 2011, the accident at the Fukushima Daiichi nuclear power plant caused a leak of radioactive iodine. Then, what was the effect of the radioactive iodine that leaked out? This slide is based on the data from the Chernobyl nuclear power plant accident and shows the risk of thyroid cancer depending on the amount of exposure. Looking at this slide, you can see that the risk of thyroid cancer increases when it exceeds 200. This is the dose for residents around Chernobyl. This is the dose at which the risk of thyroid cancer begins to rise. And this is the dose for residents of Fukushima. Look at this data and answer the questions. What kind of measures should be taken in Fukushima? I don't know. How about you, Ed? Looking at this data, I cannot say that special measures are necessary. I agree. It is an order of magnitude less than the level at which health damage may occur. So it's natural of thinking that you don't have to take any special measures. In 2011, the Fukushima Health Management Survey was started. This is the project to conduct the thyroid ultrasound examination once every 2 years for all children under the age of 18 who were living in Fukushima at the time of the accident. For children attending school, it started in the form of school checkups. Now, let's see what the result of this test will be. Let me give you a little more information. I bet this is what you are thinking of. Thyroid cancer grows slowly and appears after middle age. The incidence of thyroid cancer in children is said to be a few, in 1 million. The population of Fukushima Prefecture is 380,000. Now let's predict the result. How many thyroid cancers will be found? Roger, what is your answer? I wonder if there is one or none. Maybe you are thinking about symptomatic cases, but ultrasound can find asymptomatic cases too. Then what do you think will happen? How about you, Ed? I'm not sure. The symptomatic size is 3 to 4 centimeters, and the cancer shows an evident nodule. Ultrasound can detect very, very small cases. If so, add a little more. How many it will be? 1, 10, or 100? If you search intensively, you will find about 100. That's correct. We found 100 people, nearly 100 times more than usual. By the way, more thyroid cancers were detected in the examination 2 years later, and more than 300 children have been found so far. In Fukushima, usually only a few out of 1 million children develop thyroid cancer, so the number of cases found at this stage should have been in the double digits. How did this happen? Probably because they searched extensively. What do you think would have happened to these people if they hadn't had the ultrasound? The symptoms would have gotten worse. If you think about it in the usual way, it will be so. But in fact, it has come to be said that it is the wrong idea. I'll explain why. The idea is that you already had a small thyroid cancer when you were a child. In the teens, there is a very small thyroid cancer that slowly grows and symptoms appear in middle age. However, the children in Fukushima were examined once every 2 years. They found 116 cancers in the first examination. However, 2 years later, 71 cancers were found again. Isn't this strange? If you pick them all up in the first examination, you won't find many 2 years later. So you can understand this way of thinking is wrong. What were found in the children were not the cancers that grows after middle age. So what's going on? You are very talented if you can answer this. It's a diagnostically cancer, but it isn't cancer that leads to death or something like that. Well, I'm a little bit confused. Okay, let's provide a little extra information. Here are some of the things we have learned since then. This is Korean data. In South Korea, thyroid ultrasonography began in 2000 as part of health checkups. Applying ultrasonography, small thyroid cancers were found one after another. However, surgical removal of small thyroid cancers found did not reduce the mortality rate from thyroid cancer. In other words, it turned out that even if a small thyroid cancer is operated, it is useless. Another piece of information about what would happen if such a small thyroid cancer is left without surgery. the upward direction is the size increased and the downward direction is the size decreased. Even after long observation, these cancers do not grow very much. On the contrary, some cancers become smaller. Especially after middle age, these cancers rarely grow. Then, when it comes to where it grows up, it can only be when you are a child. This means that these cancers grow rapidly in childhood, then stop growing and remain small for the life. The way the thyroid cancer grows is actually something like shown in this slide. A basic image of thyroid cancer is that it appears in middle age and grows rapidly. However, aside from this type, there are cancers that grow rapidly in childhood, but then stop growing and remain small and unnoticed for the rest of the life. They are called napping rabbits. In the case of South Korea, they worked hard to operate on these napping rabbits, but the mortality rate did not decrease because it is different from the cancer that kills the patient. In the case of Fukushima, they are trying hard to find the early stages of the outbreak of napping rabbits. There is a problem with doing this. What is that? What about future mortality rates? It won't go down. Exactly. It is unlikely that it will go down. If so, what is the meaning of the surgery they are doing now? This is called overdiagnosis. Many people believe that cancers are always fatal, but there are quite a few cancers that are not. Overdiagnosis is a diagnosis of such cancers that do not cause harm for the rest of the life. We know that all cancers can be overdiagnosed, and that thyroid cancer in particular has a higher risk of overdiagnosis. So what kind of problem will arise if thyroid cancer, which is essentially harmless for the rest of your life, is diagnosed in childhood? High school students are the most common. A small thyroid cancer is found when you are in high school, but it's like doing anything wrong, but you have a cancer diagnosis. My family worries about me. Exactly, the family will be sad. What happens then? I worry if there are another cancer. Well, yes, but you already know you have thyroid cancer. I would love to have surgery. That's right. What percentage of patients do you think actually opt for surgery? Almost everyone? That's right. It takes a lot of courage to go untreated when you are told you have a cancer. Medical students are often found to have a small thyroid cancer during an ultrasound examination in the practical training. What do you think they will do? If it is left untreated, 99% is an exaggeration, but probably nothing will happen at a probability of 95%. If this is your case, do you want it to be untreated? If there is as much as 5% possibility, I might be worried. In reality, most of the students in medical school have surgery. It's hard not to have an operation after being diagnosed with cancer. As for the harm of overdiagnosis, first, there are the health implications. It leads to unnecessary surgery, then surgical complications can occur. A large thyroidectomy can lead to a lack of the thyroid hormone. Apart from this, being diagnosed with cancer is actually a huge burden. Wouldn't you understand if you put yourself in your own shoes? As of today, I am a cancer patient. You know, that would be a pretty big change. In addition, you will not be able to get health insurance or get a loan. I hate to say it, but there is also marriage discrimination. There is no problem between the boys and girls, but there are many cases their parents do not like their children's partners. Let's take a break and think about how to solve this problem in the next session.